An email that made rounds late last year cautioning women to take care of their house helps is perhaps the most recent and clearest indication that wet nursing continues, though subconsciously. The email read, "In one of the households in central Lusaka, a couple was having problems at home with their first child, who was only 9 months old, but was already becoming a sickling. A test showed that the new infant was positive with the worst and most devastating of the 3 human immunoviruses so far discovered. It's believed to be transmitted and propelled through infection and reinfections." The maid willingly said, "At times the baby would cry a lot and so hopelessly refuse the feeding bottle. She would feel for the child, and since she loved him, she would then breastfeed the child, upon which the child would stop crying and fall asleep. And that continued for a long time. The child died from AIDS-related sicknesses." Mother-to-child HIV transmission remains one of the biggest risks of wet nursing. One that these 2 sisters, Linda and Rita, who share a bond that some find rather baffling, especially in this age and time, never thought about.
For me, I think knowing that the breast milk is better for my child, I would still do it. She's actually the one who makes them full. Mine is just because now I'm the mother and she wants, you put the baby there. But if I want the baby to be satisfied and have a good night's sleep, she will do it for me.
Wet nursing, where another woman breastfeeds your baby, is an age-old practice that quietly continues to date. Before, it was either as a substitute for infants whose mothers had died during or after childbirth, or by caregivers in cases where the mother was away on duty.
Don't shoot, baby.
The Oyers are lucky that none of them was infected. They enjoyed the benefits of infection-free wet nursing. But in Kilifi, baby Harriet wasn't so lucky. A few days of skipping breastfeeding sentenced little Harriet to a life of medication.
Nilipomzaa nikakaa naye, alipofika umri wa kuwa anatambaa, mimi mwenyewe ndio nikashikwa na ugonjwa. Niliposhikwa na ugonjwa nikapelekwa hospitali Kilifi na nikalazwa.
Harriet's mother was epileptic. She left the little girl in the care of her grandmother.
Muda huo niliokaa huko nikaambiwa amemnyonyesha. Sikujua ni mgonjwa na yeye mwenyewe pia hakujua ni mgonjwa.
The grandmother died 2 years later of AIDS-related complications. Wet nursing may be employed if the mother of a baby is unable to breastfeed her infant due to drug use, whether that from prescription or illegal, or through illness, death, breast cancer, or unwillingness by the mother.
In such instances, the HIV status of the wet nurse must be known. The HIV status of the baby must be known. The wet nurse must be someone who will abstain from any risky sexual activity that may make her infected in the course of her breastfeeding the baby.
Other diseases that can be transmitted through breastfeeding, and if the mother is not treated, include tuberculosis, hepatitis, among other blood-transmitted diseases. So, should the domestic worker be involved in some training on HIV and prevention of mother-to-child transmission? What's the place of the domestic worker?
What they can do is to make sure that there is enough education on maybe how to handle or to avoid situations which can cause maybe transmission.
Well, trends like wet nursing are still here with us. And while the government works towards achieving its 2015 goal of total eradication of mother-to-child transmission, trends such as wet nursing must be addressed. Violet Otindo, Citizen TV, Nairobi.